Hello, my name is Doug Breunlin, and I'm the Program Director for the Masters of Science in Marriage and Family Therapy at the Family Institute at Northwestern University.
And my name is Liz Jacobsen. I am a graduate from the Family Institute at Northwestern with a Master's of Marriage and Family Therapy in 2013.
So the idea for this paper grew out of my experience as a program director, where after a few years of being in the job, I realized that our students actually did not see what I call whole families that often. They either were doing more individual therapy or what I am going to call relational therapy, where they would have a part of the system in the room with them.
I was surprised in my experience as a student when I came to become a marriage and family therapist. I was expecting that I was going to work with entire families most of the time, including parents, grandparents, other parts of the system, siblings together. And what I found is that while I was being encouraged to bring as many people in the room as possible, it was very difficult to bring whole families together. I was mostly working with subsystems, either just kids, just siblings, or just with one sibling and a parent instead of getting the entire family in at the same time. What I found is that I needed to do it took a lot of my own energy and a lot of supervision and a lot of support to be able to bring whole families in together. But once I started to be able to do that, it was so thrilling as a student to have that experience, to see change happening, to have moving parts in the room. Even though the work felt more difficult, it was also so deeply rewarding and something that really was exciting for me to see in a way that I hadn't experienced before when I was working with subsystems or with individuals.
So we believe that whole family therapy is still a worthwhile thing to do. We also know and recognize that there are many forces that are present in this 21st century environment that are different than they were when family therapy first got started many years ago. So what happened? The graduate training programs are now the primary source of training for marriage and family therapists, and they have actually a much harder time getting whole families involved in therapy. So what we need to do is to find out, how do we understand the value of whole family therapy, get our students excited about it, and how do we overcome some of the constraints that exist in programs to actually doing whole family therapy? Because the freestanding institutes that once existed many years ago and did a lot of whole family training, they just don't exist anymore.
So some of our ideas for how to spark a passion again for this kind of work in the field are that it has to start in training centers with students and students having the support and the infrastructure they need from the programs to be able to get whole families in the door to begin with. I think also there was some resistance from the families I worked with in trying to help them understand why it was helpful to bring the entire family in, how it was helpful not only to help understand the presenting problems better, but to harness the strengths that a family has. And as a student, it took me a while to develop what we call the gravitas I needed to be able to work with a whole family, and that's still something I'm developing, but through excellent supervision and the support I needed, it's something that started a passion in me that I hope that I will carry into the field as I graduate, and that's our hope for other programs as well, is that more family therapists can carry that passion for whole family with them.
So having been trained as a person who values whole family therapy, once you get the bug, it's hard to give it up, and that the only way you pursue is if you gain the confidence to do whole family therapy. So programs essentially need to be much more decided about how they set themselves up so that whole family therapy is a basic part of the curriculum. And that ranges all the way from how you recruit students so that they arrive at your door passionate about marriage and family therapy, how you bring cases to your clinic so that they are more likely to be whole family cases, and then how your supervisors work with students to turn a case that might be an individual or a fragment of a family into a whole family case. And we know that in the modern world, Whole family therapy is probably not going to be the thing that you do from the first session to the last session, but we truly believe that it should be an important part of how you do family therapy, and that at some point all cases should have a whole family therapy episode as part of them.
Yes. Thank you so much for watching this video, and we hope that you will continue to read our paper.
Yes, and give us some feedback.
Thank you.
Thank you.